Please, huh?
Good evening, everyone. We'll start with the class. It's already 7:15. So today there are 40 questions for revision. We'll try to finish fast. So start. So give our answers little bit faster. So there are questions from all the 12 weeks we have discussed till now. Please don't go by the numbering of the questions. Those are not correct. In total there are 40 questions. That's all. Okay. Don't go by the numbering, like there is no sort of serial numbers I have given for all the questions. I have included few questions from every week. Okay, so yeah, let's start with the first question of today. I'll give 2 minutes time for each question. Okay. I hope everyone is able to see the slides. First question. As per NFSH 5 data, the number of stunted and underweight children increased after 6 months of age. What could be the reason for this? Start answering. And yes, please keep noting down how many correct answers and wrong answers you all are giving. We'll see at the end of the discussion. So it shows how you are a person. Still recording is going. Shows how. Okay. You're not saying. You're not. Okay, everyone is done. Let's see what is the correct answer. It is C. Minimum adequate diet was not started after completing 6 months of age. Moving on to the next question. A dash nutrient deficiency is commonly diagnosed in two ways. First, the unique symptoms of deficiency are recognized. Okay, I'm so sorry, the answer is already given. Then the level of the nutrient in the body is measured by a blood test. Type 1 or type 2. So it is type 1. Already I have kept the answer by mistake. No problem. You can just skip this question. So we have already discussed type 1 and type 2 nutrient deficiency. What happens in type 1? Child continues to grow, but the tissue levels of nutrients fall. So there are specific symptoms that arise due to type 1 nutrient deficiency. In type 1 nutrient deficiency, all the vitamin deficiency are also included. Type 2 nutrient deficiency is what? The child growth slows down, the tissue levels of nutrients are maintained, and but there is no specific symptoms. Okay, moving on to the next question. As per CNNS to 2016 to 2018 data, which state has the highest percentage of 5 to 9-year-old children with high blood sugar? Manipur, Kerala, Haryana, Punjab. Start answering. Okay, let's see what is the correct answer. It is A. Manipur. Manipur is the state with the highest percentage of 5 to 9-year-old children with high blood sugar. Moving on to the next question. As per CNNS 2016 to 2018 data, which of the following places has the highest percentage of 5 to 9-year-old children deficient in vitamin B12? Start answering. Okay, let's see what is the correct answer. It is D. Punjab. Punjab is the place where the highest percentage of 5 to 9-year-old children are deficient in vitamin B12. Next question. Along with folate, which other nutrients are necessary to prevent neural tube defects? Calcium, potassium, choline, and omega 3, vitamin B12, and choline. Start answering. There is Let's see what is the correct answer to this question. It is D. Vitamin B12 and choline. These are the nutrients that are necessary along with folate to prevent neural tube defects. Okay. Moving on to the next question. Where does carbohydrate digestion begin? Stomach, small intestine, mouth, large intestine. Okay, let's see what is the correct answer to this question. It is C, mouth. Where does carbohydrate digestion begin? It begins in mouth. Moving on to the next question. As per NFSH 5 data, which state has the highest percentage of stunted children under 5 years of age? Haryana, Gujarat, Maharashtra, Meghalaya. Okay, here also I have kept the answer, so just leave it. It is Meghalaya. Meghalaya has the highest percentage of stunted children under 5 years of age. Okay, moving on to the next question. Insulin's response to different food items varies. Which foods have the least stimulating effect on insulin? Carbohydrate rich foods, fat rich foods, protein rich foods, fiber rich foods. Start answering. Let's see what is the correct answer to this question. It is B, fat rich foods. So these are the foods which are having least stimulating effect on insulin. Okay, so fat rich foods are the one which have the least stimulating effect on insulin. Moving on to the next question. Highest amount of selenium is present in which gland? Pituitary, thyroid, pineal, hypothalamus. Start answering. It's already the explanations and everything is done in the previous weeks. That's why I'm not doing it now again. Okay, because we have 40 questions. So yeah, this was the so what was the question? The foods which have least stimulating effect on insulin. So here you can see it is written already. Most natural foods contain varying combination of three macronutrients and therefore raise insulin to varying degrees. So we are here they are asking which food will increase the insulin level to least. So for example, carbohydrate rich foods will obviously increase the insulin level because it includes all the sweet things, so raising insulin and glucose. Fat rich foods are the ones like salmon, here example is given for fish, they have the least effect on insulin. This differing ability to stimulating insulin means that foods also differ in their fattening effect. This is also only common sense. So fat rich foods are the one which have the least effect on rising raising insulin in your body. Okay. Yeah, I was saying about the next question. The correct answer is B. Thyroid. Highest amount of selenium is present in thyroid gland. Okay. Moving on to the next question. As per NFSH5 data, which state has the highest percentage of babies who are breastfed within an hour of birth? Haryana, Gujarat, Maharashtra, Meghalaya. Start answering this question. Yeah, let's see what is the correct answer to this question. It is D. Meghalaya has the highest percentage of babies who are breastfed within an hour of birth, according to the NFHS 5 data. Moving on to the next question. What happens to the excess glucose we consume? Excess glucose is used up to provide us energy. Excess glucose gets converted to glucagon. Excess glucose gets converted to a body fat and glycogen. Excess glucose does not get absorbed in the body. Start answering. Let's see what is the correct answer. It is C. Excess glucose gets converted to body fat and glycogen. Moving on to the next question. Poor attachment of the baby's mouth to the breast will result in areola feeding, nipple feeding, breastfeeding, proper feeding. Start answering. Let's see what is the correct answer. It is B. Nipple feeding. Moving on to the next question. A nurse explains the benefits of delayed cord clamping to a pregnant lady. What do you think could be the benefits? It helps to improve vitamin A store, it helps to improve vitamin D store, it helps to improve calcium store, it helps to improve iron storage in the liver by following blood flow between the placenta and the baby. Moving on to the start answering. Okay, let's see what is the correct answer. It is D. It helps to improve iron storage in the liver by allowing blood flow between the placenta and the baby. Moving on to the next question. For premature babies, dash is very useful. Excuse me. Cradle fold, kangaroo mother care, football hold, sideline hold. Start answering. Let's see what is the correct answer to this question. It is B. Kangaroo mother care. On to the next. What should a just delivered mother do to pass on infection fighting elements, good fat, and nutrients to a newborn baby? Give formula milk, breastfeed the first milk, that is colostrum, give honey in formula milk, give honey in animal milk. Start answering. Let's see what is the correct answer. It is B. Breastfeed the first milk, that is the colostrum. When the baby opens its mouth widely to breastfeed, where should the baby's upper lip be? At the nipple, at the border of lower areola, at the border of upper areola, a little above the nipple. Start answering. The correct answer is D. A little above the nipple. Moving on to the next question. In cross cradle hold for breastfeeding, the mother should hold her breast in which shape? From the side in a C shape hold, from underneath in a U shape hold, from underneath in a scissor shape hold, from the side in a scissor shape hold. Correct answer is B, from underneath in a U-shaped hole. Moving on to the next question. The mother is breastfeeding regularly but the baby is not growing well. Which of the following could be a reason for the baby's poor growth? Mother is feeding very frequently, mother's milk is not enough, mother is not feeding both fore milk and hind milk from one breast completely, mother is not giving formula. Correct answer is C. Mother is not feeding both fore milk and hind milk for one breast completely. Moving on to the next question. When a mother asks about a nipple shield, it is important to first ask her about her breastfeeding technique and problems, her breast and nipple size, her budget for nipple shields, size of her areola. Start answering. The correct answer is her breastfeeding techniques and problems. Moving on to the next, what other foods and fluids can be given to a baby under 6 months of age? Fruit juice, rice water, formula, nothing except breast milk. The correct answer is D, nothing except breast milk. Moving on to the next question. New mother is having trouble with attaching the baby deeply to her breast and getting more milk by day 3 of birth. What could be a possible reason among the following? Breastfeeding was not started within an hour of birth. Mother who has big breasts. Mother is not talking to the baby. Baby is not hungry. The correct answer is A. Breastfeeding was not started within an hour of birth. Moving on to the next question: in how many days should a new nutritious food be added to the baby's diet? Every second day, every third day, every fourth day, every fifth day? Start answering. Let's see. The correct answer is C. Every fourth day. Moving on to the next question. Mother is worried about food allergies. How will she identify them in her baby? Do allergy tests. Introduce one food at a time before combining them. Introduce common allergy causing foods together in one meal. Avoid all common allergy causing foods. Let's see what is the correct answer. It is B. Introduce one food at a time before combining them. Next question. What should the mother do when the child demands for a certain food only and refuses to eat the family meal? Mother should cook the food the child wants. Mother should force feed the family meal to the child. Mother should let the child choose between eating with the family meal or staying hungry. Mother should order the special food for the child from outside. Let's see, the correct answer is C. Mother should let the child choose between eating the family meal or staying hungry. Moving on to the next question. Complementary food should be started after a baby completes how many months of age? 3, 4, 6, 12. Let's see, the correct answer is C. 6 months, right? Moving moving on to the next question. Kids' party on or any special occasions are always celebrated with sweets. How does this change the child's mindset? Child craves healthy food. Child believes happiness equals sweets and eats them more frequently. Child doesn't like sweets. Child looks for healthy options in the parties. Start answering. Let's see what is the correct answer. It is B. Child believes happiness equals sweets and eats them more frequently. Okay. Moving on to the next question. If the mother gives healthy food to the child on special occasions such as dishes from the celebration recipe tutorials, how does it change the child's mindset? Child craves more junk food. Child believes happiness equals sweets and eats them more frequently. Child doesn't like healthy food. Child looks for and selects healthy options on all special occasions. Same kind of question, but it's different. So read properly and answer. Okay. Let's see. The correct answer is D. Child looks for and selects healthy options on all special occasions. Choose the correct pre-cooking techniques for the following options: soaking, sprouting, roasting, fermentation, soaking, boiling, drying and roasting, cleaning, sprouting, roasting and fermentation, cutting, sprouting, washing and roasting. Start answering. Done. The correct answer is A. Soaking, sprouting, roasting, and fermentation. Expecting mother wants to reduce her chances of miscarriage, stillbirth, and baby's mental retardation. Which nutrients should she ensure she is not deficient in? Calcium, iodine, copper, vitamin E. Start answering. Okay, let's see. The correct answer is B. Iodine. Moving on to the next question. What is the other name of folate? Vitamin B1, vitamin B3, vitamin B7, vitamin B9. Start answering. Let's see. The correct answer is vitamin B9. Moving on to the next question. What time is the best to absorb vitamin D? 8 a.m., 8 a.m. to 12 a.m., 10 a.m. to 2 p.m., 11 a.m. to 3 p.m., 2 p.m. to 4 p.m. The correct answer is C, 11 a.m. to 3 p.m. Moving on to the next question. In the first week, what should be the average weight gain of a boy per day in grams? 25 to 25.5, 28.5, 30.5, 31.5. The correct answer is B, 28.5. Moving on to the next question. How to check the accuracy of weighing scales? By weighing yourself regularly, by putting in new batteries every week, by weighing fruits and vegetables, by weighing standard known weights. Start answering. The correct answer is D, by weighing standard known weights. Next question. Why is a clean dry towel placed on the baby's tray before weighing the baby? To increase the baby's weight, to keep the baby still, to fit the baby in the tray, to reduce the chances of infection and a drop in body temperature. Start answering. No? Oh, oh, oh. अच्छा अच्छा हो भी जाओ जी भी हो हो The correct answer is D, to reduce the chances of infection and a drop in body temperature. What is the average birth weight of a boy in kilograms? 2.3, 3.3, 4.35. Let's see, the correct answer is B, 3.3. Moving on to the next question. What is the minimum amount of weight that the baby should gain between the 6th month home visit and the 11th month home visit? 900 grams, 300 grams, 800 grams, and 600 grams. Let's see what is the correct answer. It is A, 900 grams. Moving on to the next question. On day 28 home visit, if the baby's weight gain between day 21 home visit and day 28 home visit is less than 250 grams, then what should you do? Give formula milk, show poor weight gain due to breastfeeding factors and physical methods to increase breast milk tutorials, show complementary feeding tutorials to the mother, give complementary food. These questions we have discussed yesterday, so you should not be forgetting it. The correct answer is B. Moving on to the next, what is the average length of a 6th month old girl in centimeters? 60, 66, 76, 86. Done. The correct answer is B, 66 centimeters. Moving on to the next, at 6.5 months home visit, how much food should you ensure that the baby eats every day? At least 4 tablespoons or 60 ml of food twice a day, at least 2 tablespoons or 30 ml of food twice a day, at least 1 tablespoon or 50 ml of food twice a day, at least 4 tablespoons or 60 ml of food once a day. The correct answer is A. Moving on to the next, what is the minimum amount of weight that the baby should gain between the 6th month and the 9th month home visit? 400 grams, 300 grams, 200 grams, 600 grams. I got it. Correct. So the correct answer is D, 600 grams. Okay, so this was the last question. Let's know your score out of 40 if anyone wants to share. Then we will end the class. So today was the last class. I hope you all had a fruitful discussion throughout the 12 weeks we had, and all the best for your exams. Okay, okay, 39 out of 40 is very good. 8, very nice. Okay, that means you all are practicing and revision is done well, that you got these good scores. So yeah, just go through all the MCQs we have discussed till date. If the exam pattern is MCQs, as someone was saying, then you will be fine. I am not sure about the exam pattern or the exam center anything. Um, like I have no clue about all those things. My part was only to have the live interactive sessions, and today my hours are getting completed for the TA. So if you have any kind of doubts you have for the exams, just mail to the NPTEL team. Okay, they will help you. I'm sure. No need to panic at all. I think you have all have done great. Just be calm and keep revising. And yeah, thank you everyone. Okay, all the best.